No matter what health news we are talking about, I think there's a lot of conversation about clinical studies, clinical trials, the research that goes into whatever the treatment is. And Andrew is back from South Bay Medical, and he acknowledges all the time that there have been studies done on this treatment we're talking about this morning. And let's start with why those studies are important. People want to know what results are.
Yeah, for a man struggling with ED, I think these clinical studies are important because so little has worked for the guy for so many years. A man struggling with erectile dysfunction, likely taking the pill, injection supplements, and for a lot of guys, it doesn't work. For most guys, it causes bad side effects. Now, South Bay Medical Clinic, we use the most advanced form of acoustic wave therapy, the most studied and proven technology to regrow and open up blood vessels in this part of the body. We have a lot of these studies posted on the science page at southbaymedicalclinic.com, and a recent one from Therapeutic Advances in Urology, really cool. They said in their words, quote, "This is a revolutionary approach for ED. It's the new standard of care, and it can rehabilitate erectile tissue." So this is all really cool stuff showing we really can improve circulation, get rid of the erectile dysfunction and the need to take the pill.
So if someone is struggling with this, I mean, do they call your office first? Do they call a urologist first? I mean, what would you advise them to do in finding out more about this treatment?
Well, we have a medical doctor on staff that will do an assessment and an exam to make sure you're a good candidate. So you don't need to be referred by anybody. Most erectile dysfunction is blood flow related. There's maybe 15% that's not. So we want to make sure you're a good candidate, of course, for the treatments. But I'll tell you, it's so normal. If you're struggling in the bedroom, it's likely that the blood flow just isn't getting through the blood vessels like it should.
So how does this work? We have less than a minute left. When someone calls, what is kind of, tee them up a little bit on what they can expect, what that consultation is, and kind of where they navigate from there.
Yes, the doctor will do an assessment of your medical history, look at maybe medications you're taking. He'll also do something really cool, a blood flow ultrasound to check your blood vessels. That will determine if you're a good candidate. And by the way, call us during this segment, the number on your screen. We'll do that whole process for free. There's no obligation. Plus, we're including right now a little gift that produces immediate results in the bedroom. This is the first step, guys, in getting rid of your erectile dysfunction and getting your relationship back on track.
Well, there is the website, the phone number that you mentioned. Go ahead, call today. And Andrew, as always, thank you so much for your time this morning. We appreciate it.